operation theater. Since you are in, you people are in second year, third years, so you may not aware of what will be going on in the operation theater. So first of all, when you are posted in oral and maxillofacial surgery, the moment you enter into the clinicals, you need to have a, for boys, you need to have a clean shave, and the nails has to be cut for both for males and females, and you should not wear any ornament, gold ornaments, nothing you need to wear. Okay, fine. So this topic usually dealt with how we need to behave in operation theaters, or how the surgeries has to be done, and what are the precautions you need to take before operating any surgery. Fine. Fine. So this person, does anyone know who is he? Hello. So he is called as a father of anatomy. His name is Vesalius. Previously, there will be no operation theaters. These are all his students. So in those olden days, people used to store some of the corpse or the dead bodies from the graveyard in order to demonstrate to his students. So these disciples or the students, they used to go to the graveyards during night times, and they used to grab some of the dead bodies, so that he will be dissecting the body parts in a candlelight. So in those olden days, so after some development, so the OT theaters has been modified into these kind of structures. Here you can see a table here, and the steps are somewhat arranged vertically upward, so that every person can visualize what was going on in this table. So the bodies or the operating table is this one, and people used to observe from different heights. Okay, are you clear so far?
Yes,
Okay, fine,
yes.
Yes, sir.
fine. So this is called a Shushruta. He's a father of surgery in India. So in the medieval period, the OT theaters are in a open areas, so there will be no ventilation. It will be having an ample of ventilation here. So he is called as a father of surgery, Shushruta, and he is the first person to do a rhinoplasty. Rhinoplasty means modifying the nasal structures. So he has used a flap from the forehead. He has taken some amount of the skin and he has placed on the nose. He is the first person to do a rhinoplasty surgery. So he will be considered as a father of surgery in India. Okay, and his statue was in Australia. So now coming to the modern era, see our operation theaters are like this. Okay, you'll be having a monitors, pulse oximeters, Boyle's apparatus, and radiographic instruments. We have a sophisticated instruments right now. Okay, when compared to the ancient era, we have a modernized equipment. So every hospital will have an operating room, and every operating room must have a department to reprocess and sterilize the surgical instruments. So the entire operating rooms in GSL will be having around 15 to 16 OT theaters, right? So you will know soon. Okay, fine. So the entire operation room will be divided into three parts or the three areas. One is unrestricted area, the second one is semi-restricted area, and third one is restricted area. Okay, so let's know each of it. Okay, coming to unrestricted area. So here the traffic is not limited. The traffic means the people who are will be walking in and out. So we can call it as unrestricted area as a reception area.